it's not just only a regular nurse who's just working in a ward. And working in ER, you need to have a very strong personality there because patients relative are very difficult to deal with.
Hello, and welcome to the Art of Emergency Nursing podcast. This is where we share stories for inspiration, entertainment, and encouragement because we all know emergency nurses have the best stories. Now, here's your host, Kevin McFarland.
Well, my name is Darwin Marcaro Diog. I'm here in the Philippines. Currently here in Manila, which is the capital city of the Philippines. I I actually graduated a Bachelor of Science degree in nursing way back 2012. And I started working as a staff nurse in the same institutions that I'm currently in right now, way back 2014 of December. But given the opportunity, I actually came out from the medical field, so I applied for a different job in a corporate world. But opportunity kicks in. I went back in a clinical setting and started my job July 2019. And there's a time now that I was given this position to be able to provide care to our patients who are coming in to the hospital, specifically in emergency department. So since 2016 until now, yeah, I'm still a staff nurse at the ER, handling a lot of cases. Specifically, we actually handling a lot of different kind of ages, different kind of cases. But right now, since the pandemic kicks in, way back to in 2020 to be exact, now a lot of cases of COVID has been, filling up all the beds that we have in ER versus, yeah, and it's very overwhelming, honestly, very overwhelming. Like, yeah, especially here in the Philippines, like the vaccine is kind of limited. We have this category that um, we need to give the vaccine to first. We have to prioritize the healthcare workers, but it is not yet accessible to anyone. I'm not really quite sure if you have those kind of things, right? Like an ordinary person can go to the clinic, get an appointment, and get that shot, right? But here we have limited shots, and then yeah, we prioritize healthcare professionals. So unfortunately, you only have two vaccines that are available. We have AstraZeneca, and the other one is Sinovac, which is made in China. So, and yeah, I'm glad I was able to get the two shots already for Sinovac. And honestly, being an ER nurse, working in the ER COVID most of the time, I'm actually a survivor of COVID. I got confined for almost 2 months last year. Yes. Yeah, yeah. Well, I'm glad that I don't have any serious illness, like signs and symptoms. First week, I experienced like the flu-like symptoms, like headache, fever, body malaise, and I don't have taste and smell. That's the one unique characteristic of having a COVID back then. But after that, the doctors just prescribed me just a vitamin, a sodium ascorbate, and then just to boost my immune system. And I took it twice daily, like, and then a lot of fluids and a lot of fruits, to be honest. So, yeah, glad I don't have any serious symptoms. And compared to my other colleague who's used to be my staff, who used to be working in an ER as well, he's actually at the intensive care unit. Sad to say, he already had this machines that giving a support to his life and still battling COVID. So um, that's some, yeah, I mean, it's really hard, honestly. Basically, you're working in the Philippines and as a healthcare worker, specifically as a nurse, you really need to be at your own self. You just have to be brave enough to just do the tasks and responsibilities that you have signed up for. You know, and yeah, it's we're just making the most of it. Like we are just working with low stuff, but number of patients who are coming in the ER is very overwhelming. Like we have that kind of list that we usually put the name of the client, and if there are available beds, our ER officer will be the one to call them, and they will be accommodated in the ER. It's not in an emergency setup, right? It's based on the severity of the case, right? But right now, what's happening is that it became first come, first serve, like that. So it's kind of hard. Yeah, everyone is so busy. I mean, the morale of the people are very low, honestly. Like very exhausting, honestly. Just making the most of it and trying to, inspire other people as well to at least um, be brave enough to do their job. Really, yes. Well, we had the first case of COVID way back January 2020. Um, Actually, the hospital that I'm working in right now got the first case of the COVID, and it was done accidentally. Honestly, like they don't know what's going on with the patient. The patient. It's actually a a male and female who used to live in one house who have travel history outside of the Philippines. So it was the first case of COVID. You know what? What's really funny about it is that what's really interesting about that is that the medical residents doesn't know what's going on with the patients until they get this kind of swab test to perform with the patients, and it came up positive. And when that case came out, all like 70% of the staff in the ER at the same time in the intensive care unit done quarantine for 14 days. So it was very confusing, honestly, very confusing, and because we didn't have a strong protocol back then. And then came to March, that's the time that every patients are coming into the ER. Um, Imagine you don't have any beds available. The only thing that you have is a wheelchair. You can accommodate this patient, and these patients are, you know, also really curious about the COVID sign and symptoms. We don't have any protocol yet. So imagine what we're actually just doing here back then is just conducting x-rays, the blood test. It's just, make them home and do a home quarantine if they're experiencing this kind of sign and symptoms. Yeah, it's kind of hard. But, came in the middle of 2020, let's say June, July, August, September, October. That's the time that the cases actually decreasing. So we saw a slowing down of cases back then. So we noticed that Filipinos are being responsible. At the same time, the government actually implementing some rules to do some restrictions in the travel of, I mean, specifically in the travel on the traveling history of the people. They left, they can, and they, what do you call this one? They implemented lockdown for specific provinces that they're not allowed to go to the specific area. They just need to be here, and that's it. Imagine that the agony of the people. Imagine the people who's actually working outside from the city just to make a living for their family. How it sucked, and yeah, and and of course, as health workers back then, very it's very hard, and because everyone is actually relying from us, and there's some also situations that some people are also take as against staying at their specific situation. Sometimes I have this kind of situations that I was being bullied at the same time discriminated when I go to a specific area wearing my scrub suits, knowing that I'm working in the hospital where most of the moving the cases. I have experienced that many times. Like we just actually talking about you behind you. You know, you're a COVID carrier. You're not supposed to be here. You're supposed to be in a hospital most of the time. And of course, that's something that, like, okay, I mean, we're actually doing this thing for the people, but how come that these people doesn't understand what we're actually doing? So, and that's the first wave that we have. And then January 2021, that's the second wave. That's where the second wave started, where we are now experiencing. That's where the time where the UK variant came out. Like, yeah, where the what they call this one, the transmission of that variant is very fast, but the sign and symptoms is just mild, and that really hits hard. So really hits hard to us honestly, because uh, the transmission is very fast. At the same time, we see some situations where patients just came into the ER, just a normal or regular checkup, having a fever. Then all of a sudden, they just started feeling that shortness of breath, difficulty of breathing, and then we provide them oxygen. And after that, if oxygen is not enough, we give them, we hook them into a high flow oxygen therapy. And if that doesn't work after a few days, then that's the time that we have to do start intubation, and that's the patients became critical. So that kind of variant is actually alarming because we in the ER in the hospital I'm working right now, we they have established a specific um, area or department where COVID patients are being placed there. So all COVID cradle patients will be admitted here. They don't have room yet in the hospital, but they have to stay in the ER for the meantime. Imagine the staff that is needed for this particular department, you know, are needed for these patients. Yeah, I believe they also closed some of the departments that are not yet, what do you call this one? I'm not really sure that are not yet that exclusive for the patients. For example, they closed some services such as elective kind of operations. So the staff nurses there are being moved to the ER. Same with our outpatients department actually moved to the ER as well, just to augment the staffing of that department. So everything actually been doing a lot of things just to make out of the day, just to do the just to do your job. Oh well, it's originally it's actually a 26 bed capacity. Okay, we have it's a mix of from adult and a pedia and other type of cases. We also cater OB gynae cases as well. I'm not really quite sure if that the same with there in the US, but in the Philippines, hospitals is actually a business as well. So it's a private hospital I'm working right now. So basically, we cater everything. But right now, I believe we are now at 60 bed capacity because they have added around 32 bed capacity for ER COVID. Yeah, that's a lot. Actually, the ER that I'm in right now, since COVID started, they divided to three. We have ER clean, we have ER transition, and we have ER COVID. ER clean are those patients that doesn't have any signs and symptoms of COVID, of course. It's just a normal, normal abdominal pain, normal increased blood pressures. Sometimes they don't have, sometimes they have a test for the COVID that are negative. So they are being catered there. And we have ER transitions. That ER transitions are dedicated for patients who have signs and symptoms of COVID, but are yet to determine. They don't have any swab tests yet. For example, they came in due to fever. They don't have any respiratory problem, something like that. So to avoid the cross contaminations of being exposed in ER COVID at the same time, not transmitting that virus to the ER clean, we have designated them to a ER transition. Just to make sure that, to avoid cross contamination. And of course, we have ER COVID. So yeah, imagine you only have low staff, but you have three departments in the ER. Honestly, wow, that's actually a very interesting question. Originally, we have at least seven, seven, and seven. Like in a ER COVID, as much as possible, you need to at least have one charge nurse and three staff nurses. Okay, and we have 32 beds there. Imagine the patient ratio that you have. And of course, in the ER COVID, you have every case is there. You have patients who have mechanical ventilation, you have oxygen therapy, who have IG catheter, who are actually doing hemodialysis there. Everything has been part of that department. Of course, in ER, I'm sorry, go ahead. More than more than 10. Honestly, like right now we're still in at full house, at full capacity. So total probably in a year COVID we have 32 beds there. So everything has been filled out already. So plus patients who are in the year transition, we have probably around 9 beds there, and then ER clean that we have 12 beds there. So you know, um, actually a lot, and you have only few staff to work on. Yeah, yeah. We used to it honestly. Yeah, we have any choice. We don't have any choice, but just to make out of it. Well, I've nothing to lose as well because I got COVID already. I guess survived COVID. So I think the only thing I can do right now is just to do whatever I can for the patient. Yeah, yeah, yes, sir. But compared to what's happening in India, India is actually too far from the Philippines. I I can't compare. Honestly, yeah, yeah. I've been watching videos about the cases in India, and wow, I don't know. I'm speechless, honestly. Like yeah, we didn't experience that. We didn't expect, we did not experience any um, what I call this one, scarcity in oxygen, because in India, what's happening right now is that people are like going into line just in order for them to get that oxygen tank that is needed for patients. And then I saw this kind of pictures online, Facebook. Uh, I don't know that people just actually died in their vehicle, being treated in their vehicle. So imagine that. Yeah, imagine that kind of picture that that I'm totally speechless. I don't know what to say, to be honest with you. So yeah, I don't. Yeah, honestly. Um, well, here in the Philippines, we have the longest lockdown quarantine period since COVID hits the country. Yeah, we have it. Like until now, we are currently at the modified, enhanced community quarantine. We have curfew as well that you're only allowed from 4 a.m. in the morning until 10 p.m. in the evening. 10 in the evening, I should say. So 10 p.m. onward up to 4 a.m., you need to go back to your home, stay there, you know, just to take a rest, like that. And it was actually, it varies from time to time because the government needs to see the statistics of cases. So they might be put it back to enhanced community quarantine where people needs to go inside of their home 24 hours, 7 days a week. You know, we have experienced that. In exceptions to people who are working in the hospitals, who are frontliners, such as people who are working in a hospital, pharmacies, banks that are, or food or establishments, something like that. Right now, yeah, it's getting better because some establishments such as restaurant are open, but at the very minimum um, people capacity. I think 10%, probably in a 90 seating capacity of a restaurant, they just need to at least accommodate 10 people at the time. Yeah. And, yeah, yeah. Wow. So, ah, so I wish everything's being controlled now. I just read this latest news that we have here in the Philippines that new vaccines have been provided in the country, specifically like the Moderna vaccine and additional doses of AstraZeneca. Yeah. So yeah, I hope um, people are open to get the vaccines, and you know in order for us to stop COVID in the country. Yeah. Yeah, honestly, you can tell to my voice now, like I can tell you so much of it. Like, it's, yeah, actually, where everyone is tired now already, but just making out of it. Like, you know, this is beyond the normal thing that we do in the ER. It's really crazy, making us training, honestly. Yeah. Well, that's a very interesting question, to be honest, because Philippines has the highest number of Filipino nurses. Sending Filipino nurses abroad, you know, you can actually the best nurses. Honestly, I'm just to brag it out, but you know, the Filipino people are very competitive because we have experienced a lot of a lot of um and what do you call this one, like um we've been working so hard to get that raise of our salary. There was a time when it's starting way back to in 2012. There was a time that I have to pay for my training as a staff nurse. Uh, yeah, there was a time, and my first salary back then, when I get hired as a staff nurse, just around 5,000 pesos. That's around what, $50 for $50. That's for a 2 week shift. That's so low. Yeah, it seems like we're working in a department store having a minimum wage per day. So, and that's the reason why. Mhm. Well, if you're working in in the city, yes, where you have a minimum wage here, like around 400 pesos per day, and it's an 8-hour shift. But as a nurse, uh, it's totally different because there was a time that, of course, that we have to pay for our trainings in order for you to get hired in the hospital. There was a time as well where um, you do volunteers. When you say volunteer, you don't have any, well, you're not after with the pay. You are after with the experience. Yeah. So, and that's the reason why Filipino nurses are opted to go abroad because of uh, very low salary and justice kind of benefit, and the workload is very, very demanding. So yeah, and well, I in ER, in a normal days without the COVID, you know, we are catering an average of 70 patients in a day. That's for AM and in the morning and in the afternoon. But right now, since we have COVID cases, that increases at least 50% of the cases. So yeah, because in ER, it's a it's a very fast-paced environment. The only thing that you need to do is just to make sure you have the right disposition if the patient will be admitted or will be sent home or will going to keep in the ER for the meantime for evaluations like that. So it's really up to you to facilitate how fast that you can be able to determine the case of the patient. Sometimes, because of the increased number of people being admitted, there's no room available, so they have to stay in the ER for a meantime. So that adds to the ratio. Yeah, yeah, yes. So, well, I have experienced a lot of situation already. I mean, working in the ER, it's not just only a regular nurse or just working in a ward. Working in ER, you need to have a very strong personality there because patients relative are very difficult to deal with. Honestly, yes, they're very stubborn sometimes. They don't listen to your explanations. They just need what they want to hear. Uh, and people are very entitled sometimes, no matter how, how good you explain to them what situation is, what had happened, what's the problem, what's the issues. Sometimes they're not open about it. But of course, as a nurse, you need to be very careful about that. You need to be very sensitive about what is happening. They just be honest with them. What happened? Sometimes they understand it. And yeah, for almost 5 years of my experience as a staff nurse in the ER, that develops me a lot. you know, so, um, yeah, you're not being an ER nurse is not like a what? It's just not just a typical job that you just have to apply for. You need to you need to have a strong heart, strong personality there, because you're dealing with a lot of people that are very strong. They're very difficult. I'm just talking to you right now, like I'm smiling, but honestly, it's really hard. Yeah, yeah. And you have to work. Yeah, you need to work your ass out. Like you need to make sure that everything is being taken care of, like in just a blink of an eye. You know what's the case of the patient, so in your mind you need to have that kind of anticipatory kind of mindset. What's going to happen for these patients? What are the tests that needs to be done for us to make sure that we have to facilitate the admission of the patients very fast? So yeah, in my 5 years of experience, that actually develops my clinical eye in dealing with this kind of patients. And that's really something that's really important, because if you're not going to do that, if you're not going um to facilitate a procedure as fast as you can, you know patients are always coming in, and it can, what do you call this one, saturate your ER until such time that it's already out of control. And yeah, we do. We have patient care adjustments. Usually, well, in the normal days without the COVID, we're taking around at least 5 to 6 patients for one nurse. So 5 is to 1. Yeah. But if you are going to add our ER COVID, we'll need 3 staff nurses there. So most likely we have 35 or 36 beds there. So you have to divide that beds to your staff nurses. Usually around 8 or 9 or 7 beds per one nurse. And you need to have at least one skilled charge nurse to do that. That's that's a lot, and it is. It is. It's very hard. You know, sometimes you are. It's just a typical job that working in the office where you can have your lunch, you can have your breaks on time, where you can do chit chat with your coworkers. But if you are in the ER, having this kind of stuff that you need to do, sometimes the only break that you need to do is just go to the ER. Then after doing your thing, just go back to the real world, just do your stuff with the staff nurse, and that's it. Sometimes we don't eat. Sometimes we just drink water, and that's it. Just yeah. Sometimes um we we also going out in the office or in the ER is 2 hours from our original shift. So we extended our time there. And then the next day, same thing again will happen. Yes, sir. Hard. Well, I'm actually lucky as well because I'm actually working in a tertiary private hospital. Okay, because if you're just a normal person who doesn't have any insurance, doesn't have any money, I believe you're not capable of paying it. Okay, if you're working in a government hospital, that's where the most challenging situation is because well it's actually it's much affordable than a private hospital. So Filipino people are, you know, are doesn't have any means to to pay for a certain procedure, so they just opted to go to the government hospital. So basically, the what do you call this one? It's procedures are much cheaper, and of course, the medicines are funded by the government as well. So so people would love to take advantage with that. Not like in a private hospital, every penny works. You have to pay for a certain needle. They have to charge it to your credit card. They have to charge it to your insurance as well. So yeah. So well, for the hospital I'm working with, um, like 70% of them have this HMO, like the health maintenance organization thing, like insurance. So they take advantage with that because it's part of their benefits. But 30% of them are doesn't have that kind of benefits. Sometimes they do it cash out of their pocket. So, but if you're working in a government, if people are being admitted in a government hospital, of course, it is still amount that they need to pay, but it's much affordable. It's much cheaper compared to a private hospital because some medicines, some procedures are being provided by the government. Yeah, yes. And we have this kind of uh, what do you call this one? It's uh Feel Health. It seems like it's if I'm going to compare it with what you currently have right now, it seems like Medicaid in the US, where indigent people are can afford that. I mean, indigent people are taking advantage with that. So we have that kind of setup here as well in the Philippines. So yeah, and that's only applicable in the government. But in the government in a private hospital, since people have insurance, private insurance, they don't use it. Well, we in the first place we can't refuse any patients or community ER, okay, because that's a law now. That's a law, and that's our code of ethics as well. But of course, we need to be upfront to the patient as well that hey, um, we have to disclose it. Like, hey, this is the amount that you have to pay. This is the test that needs to be done in order for us to provide the care to you. In order for us to make sure that we have the right diagnosis to you as a patient. So when the patient who doesn't have money or doesn't have the capability to pay for it, sometimes they just refuse it because yeah, instead of them, um, thinking about the money for for that specific test, we just advise them just to go to a public or government hospital where they can get it much cheaper than a private hospital. So it's a matter of communication with them as well. Yes, we if there are emergency situations that we need the first aid, for example, we do that. Okay, we do that. But but of course, if just a normal, typical case of uh, certain cases who are coming into the ER, for example, abdominal pain who doesn't have any money, sometimes we just let them just go to the government hospital. No, just for them to be treated because the the expense is very. I mean the test, the medicines, the room in the ER are very expensive compared to a government, which is kind of some sort of like a free service of the government. So it's more of you know communicating with them which route they would like to. If they agree to if they're capable, if they are aware of the charges, and if they have their means to pay for their hospitalizations, then so be it. I mean, we can just continue the continue whatever we can, continue with the orders, continue with the care that we needs to provide to them. Yeah. Well, I really, yeah, actually, it's my pleasure to at least be part of your podcast. Well, thank you so much, Kevin. Thank you for reaching out and thank you for your time.
Thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.